Election watch tonight. Voters are going to decide whether to allow psychedelic mushrooms to be sold and regulated in the state of Colorado.
News 5's Andy Cohen spoke with the campaigns who support and oppose what's called Proposition 122. Andy in studio with more on what they had to say. Andy?
Hey, Rob and Diane. Proposition 122 would create what supporters are calling the Natural Medicine Health Act, which would allow adults over age 21 access to plants and fungi that affect a person's mental health and are currently considered controlled substances under state law.
The campaign promoting Proposition 122 says their goal is to help people in Colorado suffering from mental illness.
What we're working towards here is simply making these medicines as safely and accessibly available to Coloradans, who would be suffering from things like PTSD and major depression and, extreme trauma and anxiety.
Patients who wish to consume psychedelic mushrooms would do so at licensed healing centers under the direction of trained professionals.
We want to create another mental health treatment choice for Coloradans, where we're finding that traditional interventions like talk therapy and even pharmaceutical medications simply aren't working.
The campaign opposing 122 questions the medical benefit of it.
The American Psychiatric Association has stated just in July, and they are the experts on psychiatric disorders and mental health disorders. They have stated there's no scientific evidence that justifies the use of psychedelics for medical purposes right now.
He also points out the measure does not allow an opt-out for local cities and counties. If it passes, it would have to be allowed statewide.
So basically what we do is allow an industry around another federally illegal substance in our state. I'm worried about the message that sends to our kids. I'm worried about the message it sends to patients who are going to be told this is medicine when our science right now tells us this is not medicine.
Proposition 122 would initially allow those healing centers to give patients psychedelic mushrooms, but beginning in 2026, state regulators would have to expand the definition of natural medicines to include other psychedelic drugs like dimethyltryptamine, or DMT for short, mescaline, and ibogaine. Andy Cohen, News 5.